Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is September 26, 2025. This video is on an article published on 17 September 2025 titled Acute Effects on a High Fat and a High Carbohydrate Meal with and without subsequent physical activity on cardiac autonomic modulation in type 2 diabetics, published in Scientific Reports, which is a Nature Springer journal. This article will be compared with three articles. One titled Regional Myocardial Blood Flow Distribution as a Cause of Postprandial Angina Pectoris, published in Circulation. The second, Cardiovascular and Hormonal Responses to Food Ingestion in Humans with Spinal Cord Transaction, published in Clinical Autonomic Research. And the third, effects of the components of meals, carbohydrate, fat, protein, in causing postprandial exertional angina pectoris, published in the American Journal of Cardiology. I'm the lead author on all these three papers. Meals, motion, and the diabetic heart. Type 2 diabetics increases risk for cardiovascular autonomic neuropathy and is linked to higher mortality. The aim of the study is to assess the impact of high fat and high carbohydrate meals with and without physical activity on cardiac autonomic modulation. The study cohort comprised of 11 individuals with type 2 diabetes, 5 were women, mean age 65.8 plus or minus 5.9 years. Body mass index was 29.5 plus or minus 5.2. Hemoglobin A1C 7 plus or minus 0.8%. This was a single center randomized controlled crossover trial with 4 visits. Carbohydrate and fat meals with and without physical activity, 30 minutes on the treadmill. The 3R EKG and heart rate variability were monitored. Statistics, ANOVA, two-way ANOVA, heart rate variability metrics, and p-value of less than 0.05 was significant. What did they find? There were no significant changes in heart rate variability metrics across meal or physical activity conditions. Only the heart rate increased postprandially, p-value 0.016. EKG, no relevant changes in QT, QTC, PQ, or QRS intervals. Limitations of the study, small sample size, 11 individuals. No heart rate variability data during exercise. Unstandardized physical activity intensity. Short-term evaluation. And secondary analysis is underpowered. The key takeaway was autonomic function was preserved despite dietary and physical activity variation. Postprandial walking appears safe in type 2 diabetics. Implication supports flexible dietary choices and low intensity physical activity in type 2 diabetes without acute harm to cardiac autonomic modulation. This study is being compared with a study in quadriplegics or tetraplegics, published in Clinical Autonomic Research in 1997. In the tetraplegics with complete cervical spinal cord injury, meal ingestion did not worsen postural hypotension, but showed altered neurohormonal response. There was no rise in plasma noradrenaline, but a significant increase in plasma renin activity. In contrast, type 2 diabetes patients had preserved autonomic tone. Tetraplegics had disconnected sympathetic pathways. Meals in type 2 diabetes preserved heart rate variability. In tetraplegics, hormonal compensation, renin, likely helped to maintain blood pressure. Key takeaway, the site and type of autonomic disruption, metabolic versus neuroanatomic, shape cardiac and hormonal response to meals, important for tailoring dietary and rehabilitation interventions. In the American Journal of Cardiology paper, 8 men with severe coronary artery disease were studied. Carbohydrates and balanced meals reduce exercise time to angina by 30%, accelerate ST depression by 25%, and cut the duration of exercise by 20%, unlike high protein and high fat meals. The mechanism postulated by these study authors was increased sympathetic activity, increased insulin, and vasoactive peptides. The key takeaway: carbohydrates destabilize ischemic thresholds in coronary artery disease, but not autonomic tone in type 2 diabetes, highlighting disease specific meal heart interactions. Finally, circulation paper in patients with postprandial angina. Meals induce myocardial perfusion defects on nuclear imaging, PET imaging, due to redistribution of blood flow from stenotic coronary territories towards splanchnic circulation. This is in a nutshell regarding 4 papers on postprandial, autonomic, and hemodynamic changes. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom.